Hi there, I'm Dr. Mark Harriman. I'm one of several board-certified orthopedic surgeons with the Memphis Orthopaedic Group who deal with shoulder issues. Today I want to talk to you about some things you as a patient need to be thinking about before you come see one of us for your shoulder problem. Most of the patients that come in to an orthopedic surgeon have actually not had an injury to the shoulder. So what I would ask that you think about doing before you come in is think about what might have caused your particular shoulder problem. Obviously, there can be any number of injuries that you know caused your problem, but that's not typically what we see. I guess the exception would be in workers' compensation, where a lot of those patients do come in having sustained a particular injury at work. So what I'm asking you to do as a patient is to be involved in your own problem. The more you think about what is going on with your own shoulder and the symptoms that you're feeling, the more you'll be able to help your doctor come up with the right diagnosis, be able to do the right type of physical exam, and order whatever tests are appropriate. The main thing that we think about when a patient comes in with shoulder problems is what's called the differential diagnosis. What could it be that's actually causing your particular shoulder pain? Then we break that down into sort of, is it really shoulder or could it be neck? Now, those are the main two things that patients will come in and actually be complaining of shoulder pain. There are other things that I'm not going to deal with today. One of them is carpal tunnel, which actually can cause some shoulder pain. Patients that come in with neck problems that present as shoulder pain usually have pain along the back of the shoulder blade and often will have sort of a tingling sensation down in the arm, or actually pain going down into the arm and maybe numbness in the fingertips. Not always. So a lot of those patients come in thinking that it's actually a shoulder problem when in fact it may be a problem coming from the neck, even a pinched nerve. So we will help you figure out what that is. So you may come in actually with shoulder pain and I wind up x-raying your neck because that's where I think your shoulder pain might be originating. But what if it is shoulder, and that's what is typically the case? Then we have to break it down into the multiple things that can cause shoulder pain. The most common things are like tendonitis and bursitis, occasionally rotator cuff tear. A lot of patients come into the office thinking, I've got a rotator cuff tear, but that's not true most of the time. Most patients actually don't have a rotator cuff tear. If you're diabetic, there's a possibility you could have something called a frozen shoulder. Other people can have a frozen shoulder, but diabetics tend to have that more commonly, or patients with a frozen shoulder, about 60 to 70% of the time, wind up being diabetic. So the common things that we deal with are those. The uncommon things that we deal with are fractures around the shoulder. And of course, if you had a fracture of your shoulder, almost invariably you will have had some trauma to the shoulder. Arthritis is not too uncommon around the shoulder, and that's very easily diagnosed with an x-ray. Tumors occur around the shoulder, but I don't want any of you to get worried about a tumor when you develop shoulder pain, because it is in fact extremely uncommon. The main thing that we're going to talk about when you come in and what we usually see is a thing called tendonitis or bursitis. And I'll just show you on this model where that occurs. That occurs right in here under this bone called the acromion. It's a pain that usually bothers you when you raise and lower your arm. It usually feels better when you're at rest. Now, I'm not going to go into a whole lot of detail today about the actual shoulder diagnoses. So what I wanted to accomplish with this video today is to get you as the patient to be thinking about what is your shoulder pain like, what might have caused it, and the more involved you get with your own problem, the easier it is for your doctor to ask you the right questions, do the right physical exam, and order the right test. So thank you very much for your attention. We look forward to seeing you and helping you get moving again with your problem. Thank you.